Thanks for joining us here on location at Bryan College of Health Sciences for this news conference. Real special thanks to our hosts at Bryan for your hospitality and your partnership with the City of Lincoln. With me today are Lincoln City Council Member Benny Shobe, Bryan Health School of Nursing Dean of Undergraduate Nursing Dr. Teresa Delahoyd, Bryan Health Simulation Center Director Holly Chandler, and Keelana Lovell, a nurse who received training through a workforce investment by the City of Lincoln. We're gathered here today for the third announcement in Workforce Week. And during Workforce Week in Lincoln, we are highlighting city workforce investments that are delivering results that support residents' financial security, that make life more affordable, and create economic opportunity into the future. And ensuring that our community members have financially secure careers that enable them to provide for themselves and their families is one of my administration's top priorities. We also know that access to a skilled workforce is a top priority for our local employers, which is why my administration has deliberately invested the largest share of our American Rescue Plan funds on workforce initiatives that remove barriers to economic opportunity for our residents, meet the needs of our local employers, and support the overall prosperity of Lincoln. So a few years ago, when our partners in the healthcare industry told us that there was a critical shortage of trained nurses and healthcare professionals, we listened. And then we acted to fill that gap. My administration awarded the Bryan Foundation $1.1 million in the American Rescue Plan funds to create opportunities for community members impacted by the pandemic to gain educational training needed to enter the high-demand jobs in the healthcare sector. Our investment enabled Bryan to provide scholarships and training for nursing students, to credential community members as certified nursing assistants and as phlebotomists, and also to acquire a new simulation mannequin that provides nursing students with hands-on skills training. And this afternoon, I'm thrilled to share more about the results of these investments. With support from our workforce grant, Bryan College of Health Sciences has provided training to 192 total individuals. And according to the most recent data, our investment has made it possible for 50 nursing students to graduate, with 18 set to graduate this May, 59 community members to become certified phlebotomists, and 43 community members to become certified nursing assistants, or CNAs. And better yet, as a result of all of this training and credentialing, 97 of those who have been certified to date have found employment here in Lincoln, and they're fulfilling a vital workforce need in the healthcare sector. Our workforce grant to the Bryan Foundation is helping more of our community members access job training and high-wage careers that help them afford the good life. And at the same time, this workforce investment helps to ensure that when our loved ones need care, there are skilled professionals ready to provide that care, filling critical gaps in hospitals, clinics, and long-term care facilities all across our community. We are so fortunate to have Bryan Health in Lincoln to provide excellent health care for our families. And we're also fortunate to have the Bryan College of Health Sciences, an amazing resource that trains nurses and healthcare professionals throughout our state and provides state-of-the-art training facilities. And that is why we also provided a new simulation mannequin for the Simulation Center. So our next speaker is very familiar with all that Bryan does for our community and our state, and it's now my pleasure to invite up Bryan College of Health Sciences Dean of Undergraduate Nursing, Dr. Teresa Delahoyd, to share a little more about the work that's going on here at Bryan. Thank you, Doctor.
Thank you, Mayor. We are grateful to be able to share with you the impact these ARPA dollars have made on our local community. During the pandemic, there was a lot of uncertainty. However, the one thing that remained constant and became more apparent than ever was our need for healthcare workers across our city and state. Our students at Bryan College of Health Sciences were also not immune to the challenges brought on by the pandemic. They experienced illness, financial struggles, and even the loss of a loved one due to COVID. As the mayor already mentioned, in total, 69 nursing students were supported through ARPA dollars, providing them the financial opportunity to stay enrolled in their coursework. And 50 of these have graduated, with another 18 set to graduate in May of 2025 with their Bachelor of Science in Nursing degree from Bryan College of Health Sciences. This workforce grant provided the means for students to complete their education and the opportunity for them to move directly into the healthcare workforce to serve the public. This financial support made all the difference for each one of these students. The other opportunity, as mentioned, that the city provided with us was removing those barriers for those interested in healthcare certifications and also provide funding to pay for their training, specifically in the areas of phlebotomy and certified nursing assistant. So again, we have an additional 59 certified phlebotomists and 43 certified nursing assistants to support the healthcare workforce shortage. These shortages exist across our city, our state, and knowing that our community took a chance on supporting those in need who are passionate about helping others has and will continue to make a positive impact. We are extremely grateful for the commitment our city continues to make to assist in the education of the next generation of healthcare providers. Thank you very much, Mayor.
Thank you so much for all you do here, Dr. Delahoyd. And as I mentioned before, simulation is an important and actually an essential part of the education and training that goes on here to prepare our healthcare workforce. And that's why our ARPA workforce grant also included funding for a new simulation mannequin. And here to share more about how this mannequin and just simulation in general helps to train and prepare future nurses is Bryan Health Simulation Center Director, Holly Chandler. Holly?
Thank you, Mayor, for the introduction. Ladies, gentlemen, faculty, students, and members of the press, today I would like to spend a few minutes of your time and highlight the critical role that simulation plays in healthcare and the importance of funds like the American Rescue Plan Act, or ARPA. As we all know, the stakes in healthcare are incredibly high. Every decision, every action can have a profound impact on patient outcomes. This is where simulation can make a difference. Through simulation, we are able to create realistic scenarios in controlled environments where healthcare professionals practice their skills, refine their decision-making, and respond to complex high-pressure situations, all without putting patients at risk. Simulation centers like we have here at Bryan College of Health Sciences allow for hands-on learning, offering a safe space for error and growth, whether it's for medical students, surgeons, nurses, respiratory therapists, or any member of the healthcare workforce. Here at BCHS, we are so grateful to have obtained a birthing mannequin named Noelle through ARPA funding. Having this mannequin allows us to collaborate with partners to provide valuable educational experiences for our healthcare professionals in urban, rural, and critical access locations. Noelle is also an asset to our colleagues at Bryan Health. She provides a safe environment for updating competencies and skills along with practicing high-risk birthing scenarios. Simulation scenarios help bridge the gap between theory and practice. They ensure that professionals are not only knowledgeable, but also confident and competent in applying their knowledge in real-world scenarios. This training leads to better prepared teams, fewer mistakes, and ultimately, better care for patients. In short, the ARPA Healthcare Workforce Grant is integrating simulation into workforce training. The grant is allowing us to improve patient outcomes, decrease errors, increase knowledge and confidence in providers, save lives, and make healthcare safer for everyone. Thank you.
Thank you so much, Holly, and I really did enjoy the tour when we were here recently. It was really eye-opening, and your team is great.
We love having
you. Thank you. Our workforce grant helped enable nurses like Keelana Lovell to graduate from Bryan Health School of Nursing, and I'd now like to invite up Keelana to share what this support has meant to her and her career. And Keelana, congratulations and welcome.
Thank you, Mayor. I'm incredibly grateful for the ARPA scholarship, which has been a lifeline for many students, including myself, during these challenging times. Amidst the economic hardships brought on by COVID-19, this scholarship has alleviated financial pressures, allowing me to fully commit to my academic and career goals. My passion for nursing is deeply personal and was profoundly shaped by the compassionate care that my twin sister received during her treatment for cancer. The nurses who stood by her side were not merely medical professionals, they were beacons of hope. Their kindness, unwavering support, and expert care turned moments of fear into moments of comfort for her and our family. Witnessing their ability to ease her pain and bring light during our darkest days inspired me to pursue a career where I too can make such a meaningful difference. I aspire to bring the same blend of empathy, resilience, and dedication to every patient that I serve. I chose nursing because it offers a unique opportunity to care for individuals and their families during their most vulnerable moments and contribute to the meaningful overall health of my community. Nursing is more than just a career choice. It's a calling that allows me to make a tangible difference in people's lives. Lincoln's healthcare system is truly exceptional and continues to set the standard for quality care. Coming from a small town in Nebraska, I have seen how vital access to excellent healthcare is for our community. The ARPA funds have not only eased the financial burdens on students like me, but have also invested in the future of our healthcare. Today's ARPA-supported scholars will be tomorrow's nurses who will be caring for you and your family. Lincoln continues to exemplify the high standard of care that I strive to uphold as a future nurse, and I am truly honored to have been one of the recipients. Thank you.
Thank you so much, Gilana, for sharing your story, and thank you for being a healer. We're grateful. All right, next up, I just want to introduce another important leader in our community, City Council Member Benny Shobe. All of the efforts that the City of Lincoln makes to create economic opportunity for our residents and our employers depend on the leadership of our council members, and I'm so proud to work with him, and really would just like to invite you up to say a few words, Councilman.
Thank you. Thank you. Thank you, Mayor. I appreciate that. As a member of the Lincoln City Council, I've seen the positive impacts the city's workforce development initiatives have had on our residents and our local businesses. That is why I'm proud to be here today to express my support for the investments like the ones we're making at Bryan Health. The city's workforce development investments help support the financial health of our community members. These investments go even further by helping train the healthcare professionals who literally nurse us back to health. Thank you. That's a good investment for everyone in our community. On behalf of the Lincoln City Council, I want to express my thanks to the partners at Bryan Health for working with the City of Lincoln, and my congratulations to the nurses and medical professionals who earned their degrees and certificates through this investment. Mayor?
Thank you, Councilmember Shobe. All right, well, the City of Lincoln is committed to meeting the workforce needs of our community, and as we deliver on that commitment, we are working together with our partners to ensure more people have the opportunity to enjoy financial security, and more employers have the talent they need to provide really valuable services to our community. In the case of our healthcare workforce investments, that's good for our economy. More importantly, it's good for our well-being. With that, we would be happy to open things up for any questions from the media. Yes, Neil. Pardon? Oh, no questions. Okay. Any other questions? Okay. Well, thank you all for joining us for this announcement, the third of Workforce Week. I hope you will tune in tomorrow when we have a news conference at 10 a.m. because we're going to be making a big announcement about how we prepare even more of our residents for high-wage jobs in high-demand fields. Thank you so much.